Hi, hello everyone there, and once again you are welcome to your favorite channel, Mental Freedom TV. Just like we said last time, we began part 1 of what we call anorexia, and today we're going to be continuing the part 2, whereby we'll be looking at the type of anorexia. We spoke generally about anorexia, and we mentioned that we had two main types, and today we'll be looking at the first type of anorexia, which is called restrictive anorexia. Restrictive anorexia, and just like we said, anorexia speaks about is an eating disorder. It has to do with food, and when it comes now to restrictive now is a preliminary stage of anorexia, which you can determine it by limitation or restrictiveness in the intake of food, be it the quantity or the quality. So people suffer from this. You see, they eat very little, and they also have a choice of food. Sometimes some just eat just which is very small, so or fruit. Restrict very strictly the intake of food. Yeah, just because, like we mentioned, it has to do with the purpose of watching their weight. They want to maintain a particular weight. They don't want to go above board. They are obsessive about their looks, obsessive about their weight. So it is a preliminary stages. So we have to be keen in that, because it begins like that. Most often than not, people think that no, they are just being remember, we are not talking about being a vegetarian or kind of trying to be nutritive, but this one goes beyond board. It's an exaggerated form of weight watch, because we of course have to make sure we watch our weight. There's a recommended, remember that our weight has to do with it has to be commensurate to our body size, our height, and other like our age. So there are a number of factors that constitute a weight of somebody to know about a normal weight. But now when you go beyond board, when you exaggerate, it becomes a call for concern. And we are going to be looking at, like we mentioned, there are a lot of causes: psychological, biological, and mostly the psychological, because people, they want to they have that complex. They want to look good, they want to be perfect. Yeah, they want to be healed, that wherever they pass, let them see that no, this guy is not something else. So it has to do with a complex. It has to equally do with identity, ignorance of one identity, not knowing who you are, not knowing your purpose. It has to do with that. And we definitely will also be looking at the solution, the remedy to that, especially when it comes to the restrictive type. Is easier to handle it, since it's still the initial stages. So just therapy can do, normal counseling sessions can do, because they are the initial. You can even see a nutritionist who can give you a proper diet on what to take, not to exaggerate. It's very easy in that. Yeah, and you know, a group therapy as well. People who have been in the same, or who are going undergoing the same like you, they can help you. So have interactive sessions. So at still this stage here, so we need to very keen. If not, you may miss the mark, because there are some who also are not just exaggerative, but they are just kind of being keen on the way they look. So please watch out, and we'll be looking next at the second type, which is the most dangerous type, yeah, which we call the binge purge. So we look at that nextly. Thank you for watching. I hope you learned something. Please don't forget, like, share, subscribe in case you have not done. Make sure that it reaches out, let it go viral, for just know, so you know, you may be saving a life. See you in our subsequent video.